A lot of patients, they come to me with acute injuries to the knee joint, usually from sports such as soccer, badminton, rugby, and usually they give a history of having a twisting injury or being tackled by an opponent, or they land from an awkward jump. They land awkwardly after a jump. And a few things I'd like to know from them is whether there was any incidents of pop or snapping sound coming from that injured knee. If they tell me there was a pop sound and there was almost like swelling that came on quite soon after the injury, and they had difficulty walking and could not get back to the game and had to be substituted out. Now, when they give me that type of history, most likely they have an anterior cruciate ligament tear. This is the model of a right knee. This is the kneecap. This is the thigh bone, and this is the shin bone. This is the anterior cruciate ligament, which connects the shin bone to the thigh bone. Now, this ligament is only about 2 to 3 centimeters in length, and it is only about 8 to 9 millimeters in diameter. But this structure is very complex, and it provides stability to the knee joint during activities of pivoting, such as when you are chasing a ball and suddenly you have to change direction because there's an opponent in front of you. Or for people who are doing national services, when you are doing shuttle run, you are running towards the sandbag, you pick it up, you stop, pick up the sandbag, twist and turn direction. This is when the knee will start to give way. So these people with ACL tear, they usually complain of either pain in the knee, usually not because of the ACL tear, but because of associated injuries to the shock absorbers of the knee, which is the meniscus cartilage, or due to the articular cartilage injury. Or more commonly, they do not complain of pain, but they complain of instability. The problem with it is when they pivot, the knee tends to roll out position. Now, a lot of patients ask me, can this be treated without surgery? Now, my answer to that question is quite simple. The ligament, once torn, usually doesn't heal by itself. If you can have a stable knee without surgery, and you feel that you can give up certain pivoting spots, then I think you may be able to cope. However, if you are young and active and you really like to play sports such as tennis, squash, soccer, badminton, basketball, where there's a lot of running, twisting, changing direction, and put a lot of rotational stress to the knee joint, I think surgery is usually advisable. Surgery for ACL reconstruction is commonly done nowadays, and it involves keyhole approach. Tiny incisions are made over the outer and the inner aspect of the knee joint, and we are able to put in a TV camera and look inside the joint. We can assess under magnification any injured structures, and the ligament can be implanted into the joint through tiny incisions. The patient usually get up to work the following day, and however, to go back to sports, it takes up to 6 months of recovery. But if you want to go back to work, and if you are doing a desk-bound work, office work, usually you can go back after 2 to 3 weeks.